Hello and good evening, everyone. Welcome to this edition of HRI Talks. My name is Garbia Bailey, and I will be your moderator for tonight's presentation. I want to thank you so much for joining us. I'd like to share that the offices of HRI are located on the traditional lands of the Anishinaabeg, the Attawandaron, the Haudenosaunee, and the Métis people, and the treaty lands of the Mississaugas of the Credit. I am in Toronto for the most part, which is Treaty 13 and Williams Treaties land. And I invite you tonight to think about decolonizing your own mindset as we think about healthcare and how to care for each other. We have registrants tonight from all 10 provinces in Canada. Talk about unity. Everyone joining us this evening. It's very exciting. We also have a number of international participants as well. So I want to thank you all so much for being here, wherever you are. Tonight is a very special chat. Tonight, we'll explore the evolving role of artificial intelligence in substance use health care, in substance use healthcare in Canada. AI is really on top of mind in seemingly all aspects of life, from work to family, and yes, healthcare. So, we want to take a closer look at AI and what it could mean for accessing help, improving treatment, and reducing substance use harms. So, this isn't about any one tool. For example, I don't know, you might be familiar with chatbots. It's really about looking at a bigger picture, the real world risks, the opportunities, and implications of using AI in substance use healthcare. So, a little bit about HRI Talks. HRI Talks are about presenting new ideas and discoveries and studies that are helping to transform the mental health and substance use health landscape in Canada and beyond. HRI works with some of North America's most influential scientists, researchers, people with lived and living experiences, and clinicians to deliver these sessions. So, this is how it's going to break down tonight. Tonight, the presentation will begin with a moderated conversation with our expert panelists, who I will introduce you to. That's going to happen for about 25 minutes. After that, we want to open the floor to your questions. We would love to hear from you. So, that Q&A button at the bottom of your screen, at any point during the event, please drop in your questions, because we will endeavor to answer as many questions as we can before we wrap up at the top of the hour. So this is a very important element of these talks are your questions. All right, this is impossible to do. HRI Talks are made possible by the generous support of our sponsors. We can't do what we do without these folks. We sincerely thank all of our contributors, with special thanks to our presenting sponsor, CIBC. Okay, as promised, we have a panel of experts, and I'd like to introduce them to you right now. Maureen Abbott is the Director of Innovation at the Mental Health Commission of Canada, which goes by MHCC. If that's when you hear that, that's what we're talking about. Her work focuses on policy, on research, and e-mental health. She connects people, systems, and technology to improve mental health and substance use outcomes across Canada. So thank you for being here, Maureen. Dr. Kim Corris is a Vice President of Innovation and a Senior Scientist at Canadian Centre on Substance Use and Addiction. Her work centers on providing strategic leadership in transforming and integrating substance use health and mental health systems, including innovating service delivery models. Maureen and Kim are working closely together right now, so I'm very excited that they're both here to share the work. Chris Cull is also working alongside them. Chris Cull is a motivational speaker a filmmaker, a healthcare worker, a policy consultant, and recovering opioid user. Before we dive in, I think it's important to pause and shine a light on what we actually mean by AI in substance use healthcare. So that's in the context of an ongoing urgent public health crisis. This is a uniquely complex and sensitive area of care. And I think that clarity about what makes it distinct is essential to using AI responsibly and effectively, and it's essential to this conversation. So, Kim, can I start with you on
Yeah,
giving us some definition?
sure. Maybe I'll kick off with a couple things and then turn it over to my co-panelists here. Uh, for us to be on the same page is what do we mean by AI? So the definition of that. Then, in addition to that, what do we mean when we talk about we use AI? Because I think people think it means really different things, and it's important for us to set the stage. And then, Garvia, you've been using the term substance use health. That could be a new term to folks in the room here today. So,
Hmm.
want to set the stage on what that is. And I think that fourth piece is why is mental health and substance use health any different than any other health condition? So, in terms of what's the definition of the from artificial intelligence, I believe kind folks from HRI, have shared some of these resources as well. So, I encourage you to then look at that. They're in the chat. So, what we're referring to, as you can see in the chat, is the ability of algorithms that are encoded in technology to learn from data. So, that's the key piece you have to pay attention to learn from data so they can perform automated tasks without every step of the process basically having to be programmed explicitly by a human. But if you break those pieces down, the important piece is the technology learns from data. They don't learn from potentially you and me. They don't learn from your interactions only with the AI tool, but it's really based on reams of other of data. So the tool then is only as good as the data that goes in.
Right,
So I think that's
right.
super important piece. And then when we think about what is substance use health, because we talk about that, we often hear words like substance use, addiction, and often people think that this means somebody who may have, a severe disorder related to their substance use. But why we talk about substance use health, it's the same reason that we use the word mental health and not only mental illness. And Maureen's a whole expert on that for sure with her role at MHCC. But what we really are talking about is that substance use exists on a spectrum. We are all part of the substance use health spectrum. Whether we don't use it all, we have lower risk use, higher risk use, or have a substance use disorder. That would be what people may commonly know of as an addiction. We all have a place on that. And why that's important is because it really moves us beyond that continuum of you either have a substance use disorder or substance use problem or an addiction or you don't, and
Hmm.
really rounds out the fact the same way you don't even have you either have mental illness or not. No, we all have mental health, the same concept of we all have substance use health. So I'm going to stop there and kick it over to my colleagues, maybe to pick up on that unique nature of why this is relevant, different maybe for substance use in AI and what we're talking about.
Great. Chris, go ahead.
Yeah, I mean, as somebody who went through an 8.5 year addiction to opioids, and I'm a healthcare worker and work in strategy, I can look at it from various different lenses. But I mean, in simplistic terms, I mean, AI is when a computer are designed to do things that are normally require human thinking, essentially. So like pattern recognition, decision making, everything like that. And if you it basically scans the data across the internet and then does pattern recognition to give you a prediction, is
Mhm.
more or less what it does. Where we are in our current climate within substance use health and mental health on the broader scale, it's the opportunities of where this can go are quite endless. It's really up to our imaginations of where it will go. But that said, it's a rapidly evolving technology that
Mhm.
is, I think, growing faster than our ability to kind of become experts at it. So it's a very interesting time, but it's also we work in a very strange system. And
Mhm.
I think there's an opportunity here to be able to expand our capacity to streamline different processes so clinicians can actually focus on the clinical care that they need to provide with people. But from a substance use health lens, I mean, I was on methadone for 5 years because I didn't know what else existed out there. I didn't even know addiction services were a thing. And so what I could have accomplished or what I could have figured out. I mean, we have the history of the world's information at our fingertips, and now this is like that, like the internet on steroids, where you can, I mean, you can ask it. To Kim's point, the more data you put into it, the more context you give it, the better the
Sure.
answer is going to be. Because I use it every single day. But
Yep.
being literate in how to prompt it correctly. So, like, say you are an expert in addictions medicine. I'm
Mm,
a 40-year-old male and so forth, and map out the particular circumstances, how long has been going on, the things kind of just evolving with ever your substance of choices and whatever health question you
mhm.
have within it, it'll be able to answer it more accurately. But
Yep.
even just finding what services are available to you, or finding a family physician or primary care provider, and I mean, if you have a loved one who has a substance use health challenge, that you can ask it about that and what is the best way to broach this topic. And it will, the good thing about it is like it can study research things, but also study all the different lived experience stories on there to put even more context to it. But
Hmm.
it's kind of a
Yeah.
convoluted explanation, but I'll.
No, it's a great explanation. I mean, we've set the table. I think we would keep talking about the definition for a whole other session, but for now, I'd like to move on. Unless Maureen, did you want to add to this question on defining these parameters right now?
So, if it's okay, I would love to add a bit about the connection between mental health and substance use health in Canada. So, we collaborate with the Canadian Centre on Substance Use and Addiction in much of our work, and I'll tell you why. Mental health and substance use health problems are defined along a continuum, which Kim already described. So, we have the substance use health on a spectrum, but then we also have a mental health continuum, which includes healthy to reacting, ill, injured. So, concurrent disorders between substance use health and mental health happen whenever the mental health and substance use health spectrums really intersect. And we see in examples like COVID-19 when it really amplified the strong link between mental health and substance use health, and concurrent disorders have really increased since then. And I'll
Mhm.
just add a few examples before we move on around what we're seeing for mental health and substance use health for AI. So it's not only chatbots, because we might hear that example frequently, it's in the media frequently around chatbots, but we're also seeing AI being used for system navigation in these fields, triage, and clinical notes to make it easier on the experience, the clinical experience. So there's really tremendous potential for AI in mental health and substance use health.
Great. Thank you so much to all three of you. Um, from this perspective that we're using now, I want to talk about how AI can improve substance use healthcare in Canada now that we've set the table, and what challenges in the system it's best positioned to address. Maureen, can I start with you for that?
Sure. I already have my microphone off mute, so there you go.
Perfect.
So let's look first at the state of mental health in Canada. When we look at self reported well being, Statistics Canada shows that since 2015, people reporting very good mental health has steadily declined by about 20%. And only half of the population reported very good mental health in 2024. And the decline is gradual from
Mm,
2015 to 2019, but then it becomes sharper from 2020 onward. And what happened in 2020? The COVID pandemic and its aftermath. And we're seeing that older adults and men tend to report better mental health, but youth, women, Indigenous people, racialized groups, and those seeking gender equity also report worser outcomes. And
mm,
as mental health declined post COVID, then the demand for services surged, which then led to this gap in availability and access to services in the community. So we see that there's this huge demand for services and lack of access. High reported that people in Canada waited 25 days or less to access community mental health counseling in 2023, 2024. But then we also see that 1 in 10 people had to wait almost 5 months or more for services. So the point
Mm,
here is that there's variations in how people are accessing services and able to access services. So there's a strong gap for access
right.
to mental health and substance use health in Canada. So e-mental health and AI has really entered the scene at a time when people need greater access. And they might feel stigma with walking into an in-person service for mental health or substance use health care. And it's been a really natural way that AI and e-mental health has really been trying to support people seeking mental health care. And it's a great success, but also some challenges instead. But we see that people are using these services because there's better alignment with their schedules, provides more
Hmm.
flexibility, greater privacy, comfort of their in their own home, ability to access care whenever in-person services are not available, and that these tools might be low cost or no cost. So,
Hmm.
varied reasons why people are accessing this care in Canada.
That's perfect. Kim, did you want to add to that? How we are seeing these, um, how things are being addressed right now through AI, and what are those gaps that it's filling?
Yeah, for sure. And I think Chris touched on this with his example at the beginning. I started a treatment because I didn't know there was another treatment that existed, or I started something because that's what I knew that existed, or I didn't know what else existed, and the problems with access. And this almost leads to a point where, I talk to the patients that I serve and the clients that I serve, and it's care is now at my fingertips.
Mm,
People's experience with getting care, families' experience with getting care for their loved ones is often a very frustrating experience. They
mhm,
can't get the care, they perceive that they can't get the need the care they can't get the care they need when they want it.
mhm,
That there's barriers because of maybe where they live, because of long wait times, and some of the stigma, the other issues that Maureen mentioned. And even if they may have these services, they actually don't know how to navigate them, and we have a really siloed and fractured system. So I think, when we look at all the keys to what we need for system change and system transformation, from capacity building to increased health and human resources to, matching people to appropriate levels of care, digital
mm,
tools and AI is a natural piece of the puzzle, because in addition to all the pieces we talk about from a client perspective, we also have the pressures on clinicians. Um, increasing complexity of the people that we take care of, growing demands, mounting distress, um, more with less of the perception of,
mhm.
of many clinicians. And I think you put that together and it's like, okay, well, we need to do something. We have many
Right.
things in the place of what we're trying to do as a whole system in order to address these silos and fractions and hard to access care systems. And as I said, digital tools and AI is an important piece of the puzzle. The problem is the piece ready now? And does it
Right.
become a bit of a cart before the horse? And um, I'll leave it at that.
Well, I'd like to talk about that cart before the horse because I think that with any new technology, with any there is a tendency to jump in, and I don't think any of us have seen people jumping in so feet first. I mean, we're jumping in full body first. So um, I want to talk a little bit about the most significant risks or unintended consequences of using AI in substance use health for care for patients and providers and the system. Um, Chris, can I talk to you? Can I throw that question at you? The about unintended consequences and some of those risks, because I think we would be remiss if we didn't jump into that a little bit here.
Yeah, I mean, for every benefit, I mean, this is a very pros and cons type thing, and I'm not here to tell you what you should or shouldn't do, but rather that there's considerations to put in when using AI in general, much less for specific to something so personal to you. One, AI can be wrong.
Mhm,
I catch it probably once a day where I challenge it, and it will tell me it's wrong and say, "Good
mm,
pointing that out." And so you can't go into one blindly trusting what it's giving back to you because it's giving you whatever you're putting in its context. So that's number one. Number two is privacy. There are no real guardrails at the moment with privacy, and AI. I mean, so as a former substance user, we're a creative bunch, and I mean, you could, I mean, hypothetically throw in a burner email, put that in as your registration, use a VPN so it doesn't track your IP address, and ask it, fire away,
Mhm.
wherever you got. But I mean, the thing is, it's just that, like as mentioned before, it's evolving so fast that I I even put my limitations on what I put in about my personal information.
Right.
But that said, too, with the nature of substance use, I mean, narcotics are many are illegal, so it's just there is also a potential criminal component to it too that might make one hesitant to be asking it questions related to drug use and things like that. So
Mhm.
it's just there's a lot of factors into it that you really need to consider before putting in so much of your personal information and where that information might be going. One, I would
Mm.
always also look at turning everything off that ask AI how to turn off all of its privacy settings or
Yeah.
or on in all of its privacy settings so you can mitigate those risks as much as possible. The thing about
Right.
AI is you can actually ask it to be to do the things that are actually going to help you protect you from AI. So
Right. Right.
um, yeah, I mean, I could talk for days about it, but
That's a really interesting nuance, and I wonder if Kim, if I could get you to kind of build on some of what Chris was saying, which is very practical from the user standpoint, from a patient standpoint. I'm hearing a lot of that. Um, is there something that you want to build on from the provider or system sort of elements of this?
Yeah, no, absolutely. And just to contextualize some of the things I'm going to talk about, as Maureen mentioned, both of our organizations are leading some work on developing Canada's first set of guidance for the use of
Mhm.
AI in mental health and substance use healthcare. And that's really to help support organizations and systems and clinicians and people with experience and users to be able to safely and effectively use AI. And I'm sorry, there's phones ringing in the background. I can't contain
That's
what
okay.
happens in my house. So with that, both Chris is actually a key member of our steering committee as well, and so really the work that I'm going to talk about is our collective work and the work of many other people that are involved. And as part of us doing this, and the reason I'm saying all this is because we all may have a lot of thoughts about what we think are the risks and what we think are the benefits and what we think needs to be considered. But what Chris is talking about is, yes, informed, of course, by personal experience and also by the evidence and the work that we've all collectively done together. I think that's
Right.
important, especially as we go into new fields, to think about the evidence. So with that, one of the key things that we talked about, and Chris picked up on this, of course he did, is the human-centered care piece. And that's really that
Mm.
importance of there's a great risk for dissolving or devolving the pieces of care that we know are important around the human relationship and the therapeutic relationship. Can AI actually appropriately replicate that? And some of the things that we think about in that is this informed consent. Chris said, ask AI about how to turn everything off and what happens to our privacy. Do we have clear, meaningful disclosure? Do we know the limits to truly informed consent? One of the folks in the research that we done, their question was, is it really informed consent? Not really. How do
Mm.
we know we're really consenting to? Who can read a 20-page, legal jargon of this is all the things that you're agreeing to? What is the other piece that was important is that importance of supporting human autonomy and shared decision making, not just
Mhm.
preserving that human relationship with care, but we could inadvertently be shifting the decision authority to AI, which may not
Huh.
only impact us as clinicians on how we make decisions, our trainees on how they learn to make decisions, but how is AI responsible for
Mm.
those decisions? And if those aren't great decisions, who's accountable for those decisions? The other
Mm.
piece, and Chris talked about data collection and use of personal data. Where does that data go? Who has it? What are the third parties? What about data leakage and data for this the tool you agreed to being used for data to inform the data of a tool that you didn't agree to, and then human oversight or lack thereof are
Mm.
critical decisions that are being made about important care decisions that could be of life and limb. Are those being left to machines to decide for
Mm.
us? And then if we look at that system level, who's, again, back to who is accountable? Is there shared accountability? Is the system accountable? Is the developer accountable? Is the product accountable? Is the
Right.
clinician who recommends it accountable? And what are we downloading onto who or what,
Y-
as opposed
Right.
to the typical relationship. So those are some of the key. I don't know, Maureen, I think if you want to kick off to the last one that we talk about there.
Yes, thanks, Kim. So the other theme that we identified in this research is equity and data governance. And
Mm.
this is really the third critical theme because Canada has a diverse population and there's a real need to focus on equity in order to minimize bias. So think about an AI tool that is used in an Indigenous community, but the data was programmed with an urban audience in mind. So this data, it's not going to be sensitive to the unique cultural competencies of the Indigenous population. It's probably not going to be safe for the Indigenous population. So we need tools that are programmed in order to reduce bias. And a lot of the
Mm.
data that's informing the algorithms may never be gathered from Indigenous communities because these populations are sometimes in remote areas and they might not have access to the internet and AI tools as much as other populations. So a lot of the data informing these AI tools often come from places where people have access to reliable internet and where AI tools are being used the most.
Okay. I feel like we are getting such a wonderfully broad, like, I mean, if setting up the guidance is in the hands of you guys, I think that we're in excellent hands. I don't want to toot your horn too loudly, but it does feel like we are in a really in a place where all of the questions that are needed to be asked are being asked, and that's wonderful. Chris, I see that your microphone is off. Please.
Yeah, no, sorry, just to kind of build off what Kim and Marie were saying. I mean, there should always be a human involved in this loop. Um,
Yes.
uh, like I said before, AI makes mistakes all the time. And we're like an example, and this is from under the mental health kind of category, but there was an instance in the States where somebody was like, I got fired from my job. I'm looking for a bridge of this height. And where I work on a crisis team in an emergency department, I would have picked that up as a big red flag.
Yeah, of course.
But AI didn't, and that person passed away. And
Mm.
so like there's that's just one example of how why there's such a critical, it should be something that augments our work, not takes it over, and
Hmm.
to help clinicians and not replace them.
Right.
You need those nuances to be able to have an accurate reading of, and that's something that at least AI can't do at the moment.
Right. Right. Thank you for that. I want to get our audience involved just a little bit and throw to a poll that we have as we discuss all this. I want to just ask this question: um, where do you see the greatest impact for AI in improving substance use healthcare services in Canada? So I'd love for the folks that are here in the chat um, to. Um, to weigh in. So here are is it reducing wait times and access to care, supporting people to find the right services faster, expanding access for rural, remote, or undeserved communities, supporting clinicians in treatment planning and decision making, perhaps as providing support between appointments or after treatment to support recovery. And of course, if you're unsure, you can also say that I have concerns about AI's role in this space. Um, so yeah, I would love to see what people are thinking that are listening in right now by taking part in this poll. Let's see what we've got. That's a huge percentage of people saying supporting people to find the right services faster at 28% percent of the folks on this call. That makes a lot of sense. And also like bringing up the rear, I'm unsure. I have concerns about AI's role in this space. So really great stuff. Um, so let's continue with our chat. Uh, I think we touched on this, or you all have touched on the idea of trust as being one of those barriers to the use of AI in healthcare. I feel like trust is a barrier in all the uses in AI. If you're up on what's happening in the AI space, so how can AI be integrated into substance use healthcare so that patients and the public are feeling confident in its use? Can I start with who should I start with? Kim, should I start with you on this one?
Sure, happy to take the first stab on this one. Um, and I think we look at this as beyond the black box. Even
What does
as we
that mean?
try
Tell me more.
beyond
Yeah,
the
say
black
more.
box, can we explain what where the advice, where the information, where the data, where the clinical decision, where the suggestion, where the response from the therapy comes from?
Hmm.
Because as a clinician, if we can't explain it, then how could we ever recommend it? And as a client,
Right.
if you can't explain where you got your information, how can you trust that? So I think a
Hmm.
few things we think about is that understanding what does AI look like in practice, we need to be able to know how and when, as clinicians, tools can be should be used,
Hmm.
and it needs to be transparent. So people need to know when they're using these tools what they're actually using and how they can safely rely on that. So what we're talking about is emphasizing appropriate use, limits, protecting clinical reason and training, and really if AI tools are constantly changing, and we know probably the tools we talked about yesterday are different than they are today, just because how fast the field is changing, the literacy of how we use these tools isn't enough because things constantly change. So we have to really be able to explain where that information comes and where these suggestions are coming from, and they need to be transparent. You'll often talk to folks who are using these tools and you forget. I mean, I've done this. I'm using an AI tool. I forget that I start to say please and thank you to the tool. I'm like, why am I being polite? This is a machine. But we honestly, I get into this and I'm like, that's a great question. Let me think about your question. And we actually don't know. We forget because it's the by design meant to have that familiarity. We
Hmm.
actually forget that this is actually not real. And
Hmm.
how do we constantly remind people and disclose this is not a real situation, this is not a real person, you are not interacting with the person beyond behind the information that you're getting,
Right.
but
Right.
this is really that importance of that continuous disclosure because very quickly people forget what it is.
That's
I know
right.
I do.
I want to continue about that around the trust being a major barrier and give Chris and Maureen a chance to actually answer that question as well about how AI can be integrated into this care so that people feel confident, so that people feel good about its use. And I think that Kim's point on continuously checking in to make sure that folks have a sense that this is not there has to be a personal interface, like a real person interface that happens. Um, so tell me about building that trust, Chris, in the work that you've done. How does that work with AI?
Well, so one of my roles too is I'm helping the WHO develop their some of their AI work within the organization. What we're doing is creating like because with an AI model, if you're putting it together, you can choose what you're putting into it for it to reference. So you can
Hmm.
upload whatever document, statistic, or like diagnostic manual and whatever resources you want into that one model, and only play off of those things in that one model. And I think, at least from the best that, I mean, I'm not an expert in it by any stretch of the imagination, but I think you would have to do something similar, at least right now, until some of those other questions are answered. It's the AI space is a bit of a Wild West type thing at the moment, and I mean, like I said, even I have my boundaries of where of what I trust it with and what I don't, and what it's going to potentially evolve into is it's yeah, I don't have a really great answer on building trust with it, but at the same
Right.
time, I think the more we focus on it, which is what our guidance is actually meant to factor in, is being able to answer those questions so we can actually utilize it to make the models that we need to make so it can be the most efficient and really press us forward because it's going to revolutionize we are walking also into a very different world right now than we have to
Yeah.
this point. And if we go into even the next 5 years, we are looming on an economic crisis. And if we
Right.
walk into it the next 5 years with the same thinking we did coming up to this point, we're going to lose. And
Yeah.
so we have to utilize every tool to create more capacity because with hardship comes is typically where substance use thrives, and same with mental
Yeah.
health for that matter. And so we're going to need to expand our capacity in any way possible. So the quicker we can figure out where those boundaries are, where those guardrails are, I think the better we're all for it. So.
Yeah, because at the end of the day, this is a tool that can be used to expand capacity. I think that that is such an important part of why we're talking about this right now, and the important part of the work that you're doing. Maureen, have you? I'm sure. Like, I would love to be a fly on the wall as you and Kim and Chris on the steering committee are hashing out this idea of trust.
Hmm.
Um, what are the conversations or the parts of the conversation that are sticking to you when you think about this report, where it goes next, and how this trust is built?
Yes. So we did some polling with the Mental Health Research Canada in February, and we asked people, do you find AI effective for managing your
Mm,
mental health? And 76% of people found it effective for managing their mental health, which is wonderful. But then at the same time, only 14% of people actually trusted AI for mental health and substance use health. So people are using it and they're finding it effective, but then they're still not trusting it, even though they're
mm,
using it. So it's a really interesting dichotomy that we're seeing. And we also developed an e-mental health strategy for Canada in 2024. And this strategy sets out 6 priorities and 12 recommendations for e-mental health, which includes AI in Canada. And one of the priorities listed is e-mental health services and improving the quality of e-mental health
mm.
services, including AI, because we know that when services are quality, people are likely going to want to use the tool. And
Right.
it also means incorporating in these critical themes, the themes that we're talking about today, like trust and explainability, equity and data governance, human centered care. So these are all really critical to have in tools and developing guidance for different audiences. So this is really what we're trying to do is being able to contribute to be able to make AI tools more quality focused and being able to communicate that to different audiences.
And I want to turn to Hillary Dort, our HRI Manager of Communications, to share a question in the Q&A. Um, Hi, Hillary.
Hi, Garvia. Thank you. Yes, so we do have a question from the audience, and then we have a number of them that were also submitted at registration as well. So the question from our live audience member is asking about substance use, healthcare, treatment, I'm assuming, and if people are using specific mental health tools or if they're using just kind of broad general chatbots.
Mm,
And then if it's just the general chatbots, how could a human oversee these conversations for safety's sake?
okay. Kim, I see that I feel like you want to answer this one.
Yeah, no, I'm happy to start. So the answer is it depends. So
Mm,
there are some AI informed digital tools that are specific for substance use. but many tools that people use are not specific for substance use or mental health. So you will have tools that were designed to be conversational agents that you could, ask them, where should I go on summer vacation with my kids? Also be the same question that you may be asking, what do you do if you're not having a great day today and not feeling so well and a bit concerned about your safety?
Ah.
Um, and so if the tool was never designed for a mental health or substance use health intervention, um, there's going to be a lack of safeguards. Do all AI informed tools that are designed for substance use have humans involved? No. Some do, some don't. Some have safety plans, some have guardrails, some do, some don't. And this is the very issue that we face. So again, if we come back to why do we need this guidance, this very clever question that was asked by one of our live audience members, it's because then how do you, as a user, like an individual,
Right.
know what you should even be looking for?
Mm-hmm.
And how does the tool that's being, you know, promoted for to help you, or even if it's not being promoted to help you, how is the tool that one is using express its limitations and
Mm-hmm.
give you the answers to the questions that you need? There are ways to answer the last part of the question to integrate AI tools within existing care that involve humans. And you heard what Chris said at the beginning from his perspective and what our research shows at the current time, humans in the loop, which is kind of a funny term that I don't think I ever heard until I started doing this work. But anyway, having humans, which I think are people like me, clinical folks, involved in mental health and substance use healthcare. I never thought I'd have to say why should we have humans involved in care, but
Right.
why there needed to be, because at this point our technology, our structures, and how we writ large offer services aren't advanced enough or have the or have the ability to
Mm-hmm.
be the tools that people need them to be, which is why I think we get the answers of yes, I find them helpful, but I don't trust them.
Right.
Until people can say I find it helpful and I trust it, I'm not sure if, I don't think we're there yet. So there's ways to integrate this into the system, which is, if you're working with a provider or the tools, you use an AI tool to be adjunctive to that, or your tool, depending on the way you answer your questions, is connected to a provider. Otherwise, you could say you need help, or the tool should know you need help, to Chris's example, and there's
Right.
nobody there. And I just don't think
Right.
that's acceptable for people.
Yeah. I want to continue. That is such a great answer to that question because I can see that there are some other questions that are related to what you were just talking about. Again, that trust piece keeps coming up. Hillary, do we I think we have time for a couple more at least from the audience.
Yes, we do. Yeah, so I was actually going to bring forward this question. It comes from someone who identifies as a clinician working in the healthcare system, who asks or who states that I guess things can be quite siloed between different kinds of service providers. They're asking if there are any AI tools in development to help with continuity of care, or are there any clinical decision tools that are out there?
There are different apps out there that I mean I know a little bit about, but not comfortable enough to be able to try to explain it all down. So I think either Kim or Maureen probably be best to.
Yeah, and
Over
there
to
there
you,
are
Kim. Yes.
yeah, there are, just being a clinical person, there are tools that are in development to help with the continuity of care, and I've seen some of these tools in terms of aftercare, how we can use them to support care transitions, how we could support. But in terms of, I think I found out how to press the button for the Q&A, so I feel pretty proud of myself at the moment. So I can actually now read the question because, to be honest, I forgot the question. But in terms of collating patient history together, um, outside of what we have, I think I'm not sure if it's pharmacist or pharmacotherapist, but uh, at this point, patient data that I'm not aware of any patient data that's being shared outside of healthcare systems to third parties to collate this across different systems. I can speak to other projects that are happening that allow us to, move towards a one chart and one system way, but not specifically relying on AI because we have I'm sure, as you know, as a clinical person yourself, pretty intense privacy and other types of laws, confidentiality laws that would prevent us from putting data outside an AI. But there are solutions being looked at. I can speak in, provincially and at various health system levels in terms of how can we coordinate sharing patient data from multiple institutions and multiple providers into a single place. But I'm not aware of an AI tool doing that specifically. I don't know, Maureen, if you know.
I'm not aware of any tools specifically, but I do want to say that I think you've really touched on a bigger problem. So I think, an AI tool could certainly help, but I think, like the leadership also needs buy-in across the country around a lot of, sharing of this data, which is a real issue that we're seeing in Canada. So, I think in developing an AI tool to support this would be wonderful, but I think we also need more leadership across Canada in terms of sharing these data, not only between mental health and substance use health, also between physical health, mental health, and substance use health as well.
One thing I'll add
Perfect.
into that is it poses the question within transitions of care is how much access to an individual's health history do we give it? I mean, and working in an emergency department, I mean, we factor in everything. We go over all of the
Mhm.
different, like whatever brought them in at whatever point in time in their life that might be related to what's going on then, and try to factor that into our thinking. With the uncertainty of where that information goes and utilizing it across, say, different organizations to kind of create a good transition for somebody, it's just okay, well, where does that data, is there somewhere in that loop that data might be being taken and used for whatever reason that's, I mean, because private, we like at the hospital, we are very strict on privacy. Like if you go into someone's wrong chart, you have to call privacy and tell them that you went into a person's wrong chart, the wrong chart of a patient, and let them know. So where that plays into, like, say, a hospital to a different organization or a community organization, it poses a lot of questions of how you can do that and integrate and what information is allowed to go transfer beyond that, and how do we ensure the safety rails are kind of in place for it.
Yeah, that's a great point, Chris, that you just talked about. And also some of these models are actually able to, follow individuals over time and then use them for predictive modeling around who's more likely to need to come back into care. So basically early identification of recurrence risk, monitoring profiles, monitoring outcomes, etc. So when we say are AI used in transition, we're often thinking, is AI the transition coordinator? Or are we talking about how can AI tools be used to inform clinical decision making and flag individuals when they may need to come back into care, when things may not be going well, or for individuals to even self-monitor or manage their own symptoms? So, sorry, it's a big
Right.
question, Garvia.
No, it's a huge, the questions are huge.
These are big
Um,
questions. I'm looking at them. We're going to be here till 10 o'clock. Have
we
snacks.
really are. I do want to get in as many as we can. So I'm going to throw to Hillary again, to see if we can get another one, another quick one in if we can. Hillary, what do you think?
Let's do it. Okay. So, while it's so great that the guidance is being developed, the speed at which AI is being used in the public, especially individuals who are vulnerable, is alarmingly high. Is there a way we can have some overall guidance on AI tools, and have them safely reach the public sooner?
Well,
Hmm.
thank you so much for that question. And that's something that we're also closely monitoring because by the time that everything is developed with our AI guidance, things will have moved so quickly that it's almost, irrelevant. So we need to be able to find ways to be able to share information quickly and to be able to update the guidance quickly because it moves very fast. So what we've committed to doing is sharing what we know on our websites. And this is between the Mental Health Commission of Canada and the Canadian Centre on Substance Use and Addiction. And Chris is also a part of this as a steering committee member. But we've started by sharing information on these 3 themes and 10 considerations that we've been chatting about today. And that link should be in the chat for you to access. And this fiscal year, what we're looking at is developing the criteria for this guidance. So as we are developing that for different audiences, so we're thinking about patients and family members, we're thinking about researchers and policy experts, we're thinking about the developers of AI tools as well. So, really broad audiences. We're going to share what we know as we know it. So please stay tuned and stay up to date on our website. There's also a place where you can sign up if you want to have more information and be part of our mailing list and stay updated. So if you scroll to the bottom, there's a place where you can get more involved.
That's great. Thank you so much, Maureen. You know what? If you can believe it, we're just about out of time. So if we didn't get to your question or you have a comment to share, I'd love for you to reach out to us. You can find HRI's email address on our website. It's hriresearch.com. We've posted a link in the chat to a brief survey that you can share where you can share your feedback on today's session. The survey will also appear in Zoom immediately after this event. I do have one last brief question for our panelists. We have learned so much tonight. And to close the conversation, I'd like to ask each of you one last question. What do you hope the audience takes away from this chat this evening? And can I start with you, Chris?
Yeah, for sure. I mean, factoring in everything we just discussed from the trust to understanding, I mean, I think the best anybody can do is become literate in AI, like literate in how to use it effectively. I, like everybody else, started out just being like, all right, let's figure this out kind of thing. And like where I started was I'm not promoting them, but the master class. I mean, you've all seen the ads.
Mm-hmm.
And I started there with their AI courses, and one goes through like how to best utilize it as far as understanding how to prompt properly, and then the second course is how to strategically integrate in your work. The third one's
Mm-hmm.
called AI in medicine, and so I just kind of learned along. But then as I started factoring it into all of my work, I started playing around with it a lot more, and then just became a lot more familiar with it, and that dictated my level of trust for it. And
Mm,
so I think have like anything else in life, the better you can understand something, the more you're gonna have a that's gonna really dictate where your how far your trust goes with anything. But again, this
yeah,
is an evolving technology, and with that, we have to be very careful with how we choose to utilize it into our work and but at the end of the day, like I said before, I think augmenting using it to augment what we do, not replace what we do, because I mean, you can't replace human nature at the end of the day.
right.
But I hope that
Great.
everybody goes away with this with at least a little bit of an understanding of kind of pros and cons of it, and then hopefully everyone can make a decision, an informed decision
That's
of what to do moving
Thank
forward.
you, Chris. Kim, briefly,
I
real
support
quick.
all the things that Chris said, and I know we're almost at 8, and I'm not going to go more, but I think the bottom line is when we decide to interact with any system for our health, make sure our
Mhm.
choices are informed when we're doing so.
Right.
And I'm just going to leave it at that. The importance of informed choice.
Yep, absolutely. Uh, Maureen.
Yes, so I would like to leave it with a thought that with mental health and substance use healthcare, one harm is too many. So we know there are
Right.
many organizations and individuals doing great work in AI for mental health and substance use health, and we want to celebrate these. But just like in-person care, it's critical that online services are evidence informed.
Right. I think this has just been fascinating. I have learned so much. Um, Unfortunately, we've reached the end of our time for this evening's HRI Talk. I want to thank our incredible panel members, Maureen Abbott, Dr. Kim Corris, and Chris Cole for joining us tonight and sharing your expertise. It's been incredible. Special thanks to Norm Claire from the Unmarketing Group for technical support behind the scenes. Please don't forget to subscribe to the HRI Talks mailing list so you'll be the first to hear about the next event. Once again, I want to thank our presenting sponsor, CIBC. We are so grateful to our sponsors and supporters across Canada and beyond for making HRI Talks possible. And of course, the audience. You have been so wonderful. Your questions were wonderful. Thank you for joining us, for your keen interest in this topic. The conversation continues. I hope it does with your colleagues and with your friends and in forums just like this. We'll see you next time. I'm going to wish you a good night. Thanks, everyone.